15 board exam type of questions with rationalization that will cover your Pnle. 5 care of clients with physiologic and psychosocial needs. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Galvin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now. Hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Happy New Year nga po, Team Kulto! Yay! Isang panibagong taon nga po ang panibagong chapter na nga to sa ating channel ko saan we just hit 10,000 subscribers. Currently, you guys, we are now 11,000 subscribers. At gusto ko lang magpasalamat sa lahat at patuloy niyong pagsuporta sa channel ko at paniniwala niyo sa mga educational contents na ginagawa ko, especially nasa nursing at pati na rin doon sa mga contents na ginagawa ko sa YouTube. Aside from that, I would just like to also grab this opportunity para paumanhin kasi hindi po ako madalas na nakakapag-upload. Pasensya na po kayo, pasensya na. But this year, I assure you, i-hit na natin yung 100,000 mark. And I'm gonna commit myself on, uploading videos once a week. Promise ko po talaga yan. Promise na promise. Lasang kamatis. Ngayon nga, nagbabalik ako sa isang panibagong video para sa inyo. Sa lahat ng mga test takers natin ngayong darating na Philippine Nursing Licensure Examination, ito ang video na alay ko para sa inyo. Because for this video, I'm going to give you 15 board exam type of question that will cover your Pnle 5. Yes, psych nga po. Care of clients with physiologic, psychological needs. Yes, I'm gonna give you 15 questions na lumabas ng mga darating board exam kasama nung kanilang rationalization. At kung hindi mo pa nga napapanood yung iba ko pang mga nursing educational videos na create dito sa channel ko, nako, marami na po ako mga nursing test banking videos, mga concepts sa nursing. Panoorin mo sila dyan or i-check out mo yung description box kasi ilalagay ko sila lahat dyan. At kapag nagpapauto itong icon button, i-click mo lang yon because all of the playlist is gonna be linked in there. Kaya naman hindi ko na patatagalin pa ha. Alam ko itong unang video natin for this year is ang magandang pasabog nga po at good luck sa lahat ng mga test takers natin na yung darating na exam sa nursing. Kaya naman, hindi ko na patatagalin pa. Medyo mahaba itong video na to. Let me switch back to my PC and I'll see you guys in a bit. Hi everybody! Welcome back sa ating formal discussion ng iyong care of clients with physiologic and psychosocial alterations. Ito nga yung panibagong entry natin sa panibagong taon sa ating nursing test banking. At gusto ko lang magpasalamat sa inyo sa patuloy na pagsuporta nyo at pagmamahal sa channel ko. Maraming salamat po. Kaya naman wag na tayo magpatumpik-tumpik pa. Simulan na natin ito. Okay, so kagaya ng mga nursing test banking videos natin, I always have two objectives kada gagawin natin ito ha. Well, first, I will provide you and discuss to you board exam type of questions. And then the last one, and most probably the very important thing that you will take out from this video is the rationalization per each board exam type of questions. Handa ka na ba? Handa na. So let me provide to you the instructions. Now you will be given 15 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Nurses, choose the letter of the correct answer. Good luck. Ayan nga, isa-segue ko lang ulit. Kung hindi mo pa napapanood yung mga nauna na nating nursing test banking videos, nako, panoorin mo siya. Ililink ko yung actual video playlist dyan sa description box or kapag nagpap-out yung icon button, i-click mo lang iyon. Panoorin mo na rin yung iba kong mga educational video materials na ginawa ko for all the nursing students. I have tons of them and Ipapromise ko sa inyo, magko-commit na talaga ako na talaga namang this year, talaga namang papanay-panayin natin ang pag-upload. Dahil every week nga po, I promise you that I'm gonna provide to you, what's this? One video per week. Oo, nako, pasensya na nga po kayo at medyo naging busy lang talaga ako. Pero dahil nga mahal na mahal ko kayo, sisiguraduhin kong I will make time for all of you guys para sa mga upcoming test takers natin at sa lahat ng mga sumusuportang nursing stu at nursing professionals sa aking channel. Alright, question number 1. Handa na ba kayo? Let's begin. So, board exam type of question number 1. Mr. Marquez reports of losing his job, not being able to sleep at night, and feeling upset with his wife. Nurse John responds to the client, "You may want to talk about your employment situation in group today." Now, here's the question. The nurse is using which therapeutic action? Tinatanong ka, kapag sinabi ng nurse o sa sitwasyon na ito, sinabi ng nurse, "You may want to talk about your employment situation in a group." Ano daw nursing therapeutic technique ito? Is it A, observations? Is it B, restating? Is it C, exploring? Or D, focusing? Your 5 seconds starts now. All right. What is your answer? Very good. Letter D, focusing. Bakit nga po D ang sagot? The nurse is using focusing by suggesting what? That the client discuss a specific issue. The nurse then restate the question, make observation, or ask further question, which is exploring. That's why the answer is focusing. Nakuha niyo yon? Nakuha. Next question. Now, board exam type of question number 2. Tony refuses his evening dose of what? Haloperidol. Haldol. Then becomes extremely agitated in the daydream in day room while other clients are watching television. He begins cursing and throwing furniture. Nurse Oliver, first action is initial action mo kapag nag-start mag-agit at magwala ang iyong pasyente. Is it A, check the client's medical record for an order for as needed IM dose of medication for agitation? Is it B, place the client in full leather restraints? Restraints agad. C, call the attending physician and report the behavior. Wala kang ginawa, ganun ba yon? Or D, remove all other clients from the day room. Your 5 seconds starts now. Time's up, nurses. What is your answer? Very good. Letter D, remove all other clients from the day room. Why? The nurse's first priority is to consider the safety of the clients in the therapeutic setting. Safety nga po ang goal mo dito. Day room, so maraming pasyente dyan. The other actions are appropriate responses after ensuring the safety of other clients. Hindi naman sinabing mali ito na mag-check ka kung merong ang PRN orders o ilagay mo sa restraint. Pero ang tanong kasi, naku, madalas mo ito ma-encounter. First action, initial action. Taib? Taib? Gets yon? Gets. Next question na tayo, nurses. Board exam type of question number 3. Tina, who is manic but not yet on medication, comes to the drug treatment center. The nurse would not let this client join the group session because, so anong sitwasyon mo dito? Meron kang manic patient na ang pangalan ay Tina. Pero itong manic pasyente na to ay hindi pa siya talaga nagsastart ng kanyang treatment, yung kanyang medication. Bakit mo daw hindi hahayaan na itong si Tina ay mag-join sa group session? Bakit? Is it A, the client is disruptive? Is it B, the client is harmful to self? C, the client is harmful to others? Or D, the client needs to be on medication first? Your 5 seconds starts now. Time's up, nurses. All right. So what is the answer? It is letter A. The client is disruptive. Bakit? The client is disruptive nga po. Group activity provides too much stimulation, which the client will not be able to handle or harmful to self, and as a result will be disruptive to others. So tandaan mo na ang pasyente mo hindi pa nagagamutan, girl. Manic ito. So, ayaw mo na siya magkaroon ng komosyon. Okay? Gets yon? Gets. Board exam type of question number 4. David, an adolescent boy, was admitted for substance abuse and hallucination. Ano yung reason for admission mo? Abuse, substance abuse, and hallucinations. Hindi naman sinabi ko anong klaseng hallucinations, pero may hallucinations daw. So the client's mother asks the nurse, Armando, to talk with his husband when he arrives at the hospital. The mother says that she is afraid of what the father might say to the boy. Ito na tayo. The most appropriate nursing intervention would be to, so lahat ito appropriate. Pag nakakakita ka ng ganyan mga tanong, ibig sabihin nun, itong 4 choices na to, nurses, lahat ito ay appropriate. Pero tinatanong ka, what is the most pinaka-appropriate na action sa sitwasyon na ito? Is it A, inform the mother that she and the father can work through this problem themselves? Is it B, refer the mother to the hospital social worker? Or C, agree to talk with the mother and the father together? Or is it letter D, suggest that the father and the son work things out? Your 5 seconds starts now. Time's up, nurses. What is your answer? Letter C. Perfect. All right, why? By agreeing to talk with both parents, the nurse can provide emotional support and further assess and validate the family's needs. So you need to talk to the mother and the father together. Next, board exam type of question number 5. What is Nurse John likely to note in a male client being admitted for alcohol withdrawal? Ang client mo daw is alcohol withdrawal. Tinatanong ka, anong nursing findings mo na maaari mong makita sa notes mo sa isang male client na merong alcohol withdrawal? Is it B, B agad? Ano ba talaga? Is it A, perceptual disorders? B, impending coma? Is it C, recent alcohol intake? Bisaya ka, girl? Oh, no. Or D, depression with autism? Autism, mutism. What is wrong? It seems like I cannot read today. Once again, that's depression with mutism. Your 5 seconds starts now. Time's up, nurses. What is your answer? Naku, saludo ako sa mga nakakuha nito. Letter A, perceptual disorders. Bakit? Frightening visual hallucinations are especially common in clients experiencing alcohol withdrawal. That is why A is the answer. Next. Nakakarami na ba kayo ng tamang sagot, nurses? O, kalma kayo. Ano to? I think last 10 questions. So, make it count. So, board exam type of question number 6. Ira has taken amitriptyline HCl or amitriptyline, or ang brand name mo is Elavil, for 3 days now. But she now complains that it doesn't help and refuses to take it. What should the nurse say or do? Anong gagawin mo kapag sinabi ng pasyente mong, hindi naman epekto yung Elavil na binibigay mo sa akin 3 days na? Is it A, withhold the drug? B, record the client's response? C, encourage the client to tell the doctor? Or D, suggest that it takes a while before seeing the results? Your 5 seconds starts now. Pharma na may halong psych. Time's up, nurses. Your 5 seconds is time's up. What is your answer to this question? Is it letter D? Perfect. Suggest that it takes a while before seeing the results. Bakit nga? The client needs a specific response that it takes 2 to 3 weeks, a delayed effect until the therapeutic blood level is reached. Tandaan mo na kapag nagtitake ka ng mga ganitong psych medications, may mga therapeutic blood level yan. May mga duration kung kailan mo talaga ma-reach yung tinatawag nating therapeutic blood level. Okay, that is why the answer is D. So, kasi nga 2 to 3 weeks bago mo makita yung effect ng amitriptyline. Hindi yan agad-agad. Ano to? Ang galing, di ba? Bato ni Darna. Ganun ba yun? Hindi. So, 2 to 3 weeks. So, pasok pa rin siya doon sa interval na yun, yung 3 days na tinitake ni Ira yung kanyang gamutan. So, that's normal. You just have to say to your patient to allow and give it more time for you to really experience to really reach that therapeutic blood level. Tapos na tayo. Tapos na. Board exam type of question number 7. Dervid, an adolescent has a history of truancy from school, running away from home, and borrowing other people's things without their permission. Ang taray, di ba? Malikot ang kamay nito ni Dervid. The adolescent denies stealing, rationalizing instead that as long as no one was using the items, it was all right to borrow them. It is important for the nurse to understand that psychodynamically, this behavior may be largely attributed to a developmental defect related to the. So ano daw ang developmental defect nito kapag ganito ang sitwasyon mo kapag pasyente mo si Dervin? Is it A, id? Is it B, ego? Is it C, superego? Or D, Oedipal complex? Your 5 seconds starts now. Tapos na. Time's up, nurses. The answer is superego, letter C. This behavior shows a weak sense of moral consciousness. According to Freudian theory, personality disorders stem from a weak superego. That's the rationalization. Naka-move on na ba tayo sa tanong na yan? Next na. Board exam type of question number 8. In preparing a female client for electroconvulsive therapy or ECT, a nurse Michelle knows that succinylcholine or anectine will be administered for which therapeutic effect? Pinaghalong pharma at psych. Tinatanong ka lang dito, nurses, pinaikot-ikot ka lang, ano ang therapeutic effect ng iyong anectine or succinylcholine? Is it A, short-acting anesthesia? Is it B, decreased oral and respiratory secretions? C, skeletal muscle paralysis? Or D, analgesia? Your 5 seconds starts now. Time's up, nurses. What is your answer? Very good. It's letter C, skeletal muscle paralysis. Now, anectine is a depolarizing muscle relaxant causing paralysis. It is used to reduce the intensity of muscle contractions during the convulsive stage, thereby reducing the risk of bone fractures or dislocation. Malinaw yon? Malinaw. Board exam type of question number 9. Nurse Gina is aware that the dietary implications for client in manic phase of bipolar disorder is what? Tinatanong ka dito, ano ang dietary implications ng pasyente mong manic phase? Nasa manic phase ng yung bipolar disorder. Is it A, serve the client a bowl of soup, buttered French bread, and apple slices? Manic, ha? Is it B, increase calories, decrease fat, and decrease protein? C, give the client pieces of cut up steak, carrots, and an apple? Or D, increase calories, carbohydrates, and protein? Your 5 seconds starts now. Time's up. What is your answer? The answer is letter D. Increase calories, carbohydrates, and protein. Why, nurses? This client increased protein for tissue building and increased calories to replace what is burned up, usually via carbohydrates. Now, bago tayo mag-proceed sa question number 10, last 6 questions na nga tayo, I want you to really pay attention to the rationalization, ha? Because if there's anything that I want you to take out from this video, it is the rationalization. Para kahit sa mga board exam kasi o sa mga nursing examination, minsan nauulit lang yung mga tanong. The questions are just being recycled. Naiiba lang ng forma, naiiba lang ng itsura, pero yun lang naman yung isa lang yung pinopoint out nila. The reason why I want you to really pay attention to the rationalization is because mahalagang alam mo yung whys. Bakit? Bakit yun ang tamang sagot? Para pag na-encounter mo siya, you are 100% sure. 100% sure. 100% sure that is the correct answer because you know the reason why. And also, alam ko na may mga pagka-competitive tayo dito, pero at this very point in time, I really want you to just allow yourself to learn. Hindi importante kung mataas o mababa yung score mo. Ang mahalaga is may natutunan ka. Ngayon, ini-encourage ko kayo at the end of this video, I want you to put your score sa baba. Walang mahihiya, pinaghirapan mo yan. Okay? Kaya naman, hindi ko na patatagalin pa. Next question na tayo. Board exam type of question. Number 10. What parental behavior toward a child during an admission procedure should cause nurse Ron to suspect what? Child abuse. Tinatanong ka, parental behavior, parents. So, anong behavior to? Saan mo kukunin? Sa bata o sa magulang? Siyempre, sa parent, parental behavior nga eh. Ano kaya yung reaksyon o ano kaya yung klase ng behavior ng mga magulang na guilty, not guilty, but commits child abuse to their kids? Does it make sense? Alam ko it makes sense. Ganon. Is it A, flat affect? Jacqueline Jose ba to? B, expressing guilt. Antaray, Vilma Santos? Or C, acting overly solicitous towards the child? Solicitous, yung parang nagsusulisit. Charing! Yun, yung mabusisi. Or D, ignoring the child. Your 5 seconds starts now. Time's up, nurses. The answer is, you got it right. Letter C. Acting overly solicitous toward the child. This behavior is an example of reaction formation, a coping mechanism. Malinaw yon? Malinaw. Board exam type of question. Number 11. Ako, last 5 questions na. Make it count. Nakakarami na ba kayo? Of course. Number 11, Nurse Lynette notices that a female client with obsessive compulsive disorder washes her hands for a long periods each day. How should the nurse respond to this compulsive behavior? Paano ka daw magre-respond as a nursing professional? As a nurse, registered nurse, sa pasyente mong nagsishow ng compulsive behavior? That is the question. Is it A, by designating times during which the client can focus on and the behavior? Is it B, by urging the client to reduce the frequency of the behavior as rapidly as possible? Rapidly as possible talaga, girl. Or C, by calling attention to or attempting to prevent the behavior? Tandaan mo na ang client mo ay may OCD, obsessive compulsive disorder. Or D, by discouraging the client with verbalizing anxieties. Your 5 seconds starts now. Time's up, nurses. What is your answer? Very good. It is letter A. By designating times during which the client can focus on and the behavior, the nurse should designate times during which the client can focus on the compulsive behavior or obsessive thoughts. The nurse should urge the client to reduce the frequency of the compulsive behavior gradually, not rapidly or as soon as possible. She shouldn't call attention to or try to prevent the behavior. Trying to prevent the behavior may cause pain and terror in the client. Remember that. Kasi nga, sinabi ko sa inyo, OC. The nurse should encourage the client to verbalize. We never stop our patients to verbalize their thoughts and their feelings, anxieties, to help distract attention from the compulsive behavior. Hence, the answer to this question is letter A. Perfect. Last 4 questions na nga, board exam type of question number 12. After seeking help at an outpatient mental health clinic, Ruby, who was raped while walking her dog, is diagnosed with post-traumatic stress disorder, PTSD. Familiar ba tayo sa concept ng PTSD, nurses? I-comment nyo sa baba kung gusto nyo magkaroon tayo ng lecture sa PTSD, okay? Now, 3 months later, Ruby returns to the clinic complaining of fear, loss of control, and helpless feelings. Which nursing intervention is most appropriate for Ruby? So, tinatanong ka dito, ano ang most appropriate nursing intervention mo? Paano ka mag-i-intervene kapag after 3 months ng pagkaka-rape kay Ruby, ay nag-start na siya magkaroon ng fear, yung loss of control, and helpless yung kanyang nararamdaman. Paano ka mag-i-intervene? Most appropriate intervention. Is it A, recommending a high-protein, low-fat diet? Sa diet ba agad? Is it B, giving sleep medication as prescribed to restore a normal sleep-wake cycle? C, allowing the client time to heal? Time heal all wounds. Or D, exploring the meaning of the traumatic event with the client. Your 5 seconds starts now. Time's up, nurses. The answer to this question is letter D. Very good. Sino nakatama? Sino nakatama doon? Ito, explain ko sa inyo bakit. Exploring the meaning of the traumatic event with the client nga po ang tamang sagot. The client with PTSD needs encouragement to examine and understand the meaning of the traumatic event and consequent losses. Otherwise, symptoms may worsen and the client may become depressed or engage in self-destructive behavior such as substance abuse. The client must explore the meaning of the event and won't heal without this, no matter how much time passes. Hindi totoo sa kanila yung time heal all wounds, in short. Behavioral techniques such as relaxation therapy may help decrease the client's anxiety and induce sleep. The physician may prescribe anti-anxiety agents or antidepressants cautiously to avoid dependence. Sleep medication is rarely appropriate. A special diet isn't indicated unless the client also has an eating disorder or a nutritional problem. That is why the answer is letter D. Malinaw ba sa atin yon? Malinaw. Alright. Board exam type of question number 13. Meryl, age 19, is highly dependent on her parents and fears leaving home to go away to college. Shortly before the semester starts, she complains that her legs are paralyzed and is rushed to the emergency department. When physical examination rules out a physical cause for her paralysis, the physician admits her to the psychiatric unit where she is diagnosed with conversion disorder. Meryl asks the nurse, "Why has this happened to me?" What is the nurse's best response? Kapag daw ang pasyente mo, ang kinocomplain niya naman yung sa admission niya sa ER is, chief complaint niya sa ER is leg paralysis. Pero nung na-admit siya, hindi siya na-admit sa ward. Saan siya na-admit? Sa psych unit. Tapos magtatanong ito si Meryl, anong nangyayari sa akin? Bakit ako naandito? In short, ganun yun. Ano ang best response mo as a nurse? Is it A, you've developed this paralysis so you can stay with your parents. You must deal with this conflict if you want to walk again. Taray. Wala namang puso ito. Is it B, it must be awful not to be able to move your legs. You may feel better if you realize the problem is psychological, not physical. Pinagmukha mo siya talagang baliw, girl. Is it C, your problem is real but there is no physical basis for it? We'll work on what is going on in your life to find out why it's happened. Or D, it isn't uncommon for someone with your personality to develop a conversion disorder during times of stress. Huh. Taray, diba? Malditang nurse. Your 5 seconds starts now. Time's up, nurses. What is your answer? Naku, pag nagbabasa ka nga ng tanong sa psych, tandaan nyo yan, pati mga choices, kailangan may with emotions, pang MMK. Kaya naman, ang sagot dito is letter C. Excuse me. Ito, basahin ko ulit Your problem is real but there is no physical basis for it. We'll work on what is going on in your life to find out why it's happened. Bakit itong tamang sagot, nurses? Well, the nurse here must be honest with the client by telling her that the paralysis has no physiological cause while also conveying empathy and acknowledging that her symptoms are real. The client will benefit from psychiatric treatment, which will help her understand the underlying cause of her symptoms. After the psychological conflict is resolved, her symptoms will disappear. Saying that it must be awful not to be able to move her legs wouldn't answer the client's question. Knowing that the cause is psychological wouldn't necessarily make her feel better. Telling her that she has developed paralysis to avoid leaving her parents or that her personality caused her disorder wouldn't help her to understand and resolve the underlying conflict. Hence, ang sagot is letter C. Malinaw ba yun sa'yo? Last 2 questions na nga tayo. Nakakarami na ba kayo mga nurses? Excited na ako malaman yung score nyo. Okay. Board exam type of question number 14. Nurse Krina knows that the following drugs have been known to be effective in treating obsessive compulsive disorder. Ano yon? OCD. Alin daw dito? ang effective, anong medication or drugs ang effective sa paggagamot ng OCD, Obsessive Compulsive Disorder? Is it A, benztropine, cogentine, and diphenhydramine, Benadryl? Is it B, chlordiazepoxide or yung Librium and diazepam, Valium? C, fluvoxamine or yung Luvox and clomipramine, Anafranil? Or D, divalproex or Depakote, char, and lithium or litobid. Your 5 seconds starts now. Ang hirap talaga mag-pronounce sa mga gamot sa psych. Uy, meaning nyo yan, guys. Paki-like itong video na to kung pareha tayo nakaka-relate. Mahirap talaga magbasa ng mga generic name. Okay, letter C nga po ang tamang sagot dito. Luvox o yung generic name, fluvoxamine and clomipramine, Anafranil yung brand name. Bakit? The antidepressants fluvoxamine and clomipramine have been effective in the treatment of OCD. Librium and Valium may be helpful in treating anxiety related to OCD, but aren't drugs of choice to treat the illness. The other medications mentioned aren't effective in the treatment of OCD. Hence, the answer to this question, pinakatama, is letter C. Nako, last questions na. Handa ka na ba? Handa ka na. Eto na. Board exam type of question number 15. Last question for this video. Alfred was newly diagnosed with anxiety disorder. The physician prescribed buspirone or buspar. The nurse is aware that the teaching instructions for newly prescribed buspirone should include which of the following? Ito yung key term mo, newly prescribed buspirone. Anong health teaching mo sa pasyente? That is the question. Is it A warning about the drug's delayed therapeutic effect, which is from 14 to 30 days? Is it B, a warning about the incidence of neuroleptic malignant syndrome, NMS? C, a reminder of the need to schedule blood work in 1 week to check blood levels of the drug? Or D, a warning that immediate sedation can occur with a resultant drop in pulse? Naku, nakakatakot naman. Your 5 seconds starts now. Time's up, nurses. What is your answer? Nako, excited ka na ba? Make this one count. The answer is letter A. Very good. A warning about the drug's delayed therapeutic effect, which is from 14 to 13 days. Naalala mo yung tanong kanina about sa blood therapeutic level? Related sila. The client should be informed that the drug's therapeutic effect might not be reached for 14 to 30 days. Tandaan mo, unang beses itong ititake ng pasyente mo. So, wala siyang idea kung tama ba to, effective na ba ito sa akin? Bakit ang tagal-tagal ko nang tinitake? Wala namang nangyayari. Kailangan mong ma-teach sa kanya yung maturo sa kanya yung therapeutic blood level o kung kailan niya marireach yung therapeutic blood level. The client must be instructed to continue taking the drug as directed. Blood level checks aren't necessary. NMS hasn't been reported with this drug, but tachycardia is frequently reported. Malinaw yon, malinaw. Nako, nurses. Maraming salamat nga po sa panonood. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga po next week ang next video natin about sa nursing study. Kung may mga request kayo, ilagay nyo lang sa baba. Pakilagay din po ang score nyo para malaman ko kung ilan ang score ng mga pasyente ko. Once again, maraming salamat po sa pagsuporta at pagmamahal nyo sa channel ko. Happy New Year sa ating lahat. I wish you guys all the best sa mga upcoming test takers natin at sa mga nursing students dyan. Ako, maraming salamat po sa pagsuporta nyo. Happy New Year sa inyong lahat at sa mga pamilya nyo. Maraming salamat nga po. Sana po this year ay mahita natin ang ating target 100,000 subscribers. You think we can do that? I don't know, but it sounds crazy though. Alright, hindi ko na patatagalin pa. Hindi ko na kayo, I'm not gonna keep you on hold forever. But I would just like to say thank you po sa pagsuporta nyo sa akin. Maraming salamat po talaga. Tulungan nyo na nga po ako. Ipamalitan nyo na sa Radyong Sira ang pinaka-libre, pinaka-sariwa at ang pinaka-fresh na nursing review center sa balat ng YouTube. And I'll see you again next time. Thank you so much you guys for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. Hashtag Team Kulto. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box or simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account which is Neil Galve Official. Again, gusto kitang pasalamatan for making my dream come true. Maraming salamat po sa more than 10,000 subscribers. Thank you so much you guys for making that happen. And sa lahat ng mga nagko-comment sa videos ko, sa channel ko na malaking tulong, maraming salamat po ulit. I love you guys so much and I'll see you again next time.
And psychological. Psychological. 16 body on top of questions with rationalization. Blah.